If your knees feel stiff when you stand up after sitting, that's not just aging. It's a warning signal most people ignore until it's too late. After 60, that stiffness shows up an average of 8 months before the pain starts, and it's telling you something specific. The muscles around your knee are losing their ability to protect the joint. What you think is stiffness in the knee is actually weakness in the muscles surrounding it. And when those muscles fail, the joint starts absorbing pressure it was never designed to handle. 3 out of 4 adults over 60 who develop chronic knee pain said they felt stiffness first, but assumed it was normal. It's not normal. It's reversible. And the mistake that makes it worse is the one thing most people do instinctively when they feel it. If your knees feel stiff when you stand up after 60, your body is telling you this. If you've noticed your knees feel stiff when you stand up from a chair, especially after sitting for a while, you might be dismissing it as a normal part of aging. Most people do. They feel the stiffness, they shake it off, they keep moving, and they assume it's just what happens when you get older. But that stiffness isn't random, and it's not inevitable. It's a signal. Your body is communicating something specific about what's happening inside the muscles and tissues around your knee. And if you understand what that signal means, you can stop the progression before it turns into something much harder to reverse. The stiffness you feel when you stand isn't coming from your knee joint itself in most cases. It's coming from the muscles around your knee, particularly the quadriceps at the front of your thigh and the hamstrings at the back. After 60, these muscles lose strength faster than they did in your 40s or 50s, and when they weaken, they stop providing the support your knee needs to move smoothly. Without that muscular support, the joint has to absorb more direct pressure every time you stand, walk, or shift your weight. The stiffness is your body's way of saying the muscles aren't strong enough to stabilize the joint properly anymore. It's not a breakdown, it's a warning. Here's what most people don't realize. That stiffness usually shows up months before pain does. It's the earliest signal in a progression that starts with muscle weakness, moves to joint instability, and eventually leads to chronic pain and reduced mobility. When you stand and feel that stiffness, your quadriceps and hamstrings are struggling to activate quickly enough to support the movement. The longer you ignore that signal, the weaker those muscles become, and the more stress gets transferred directly into the knee joint. Over time, that stress increases inflammation inside the joint, wears down cartilage faster, and makes every movement feel harder. The stiffness isn't the problem. It's the first sign that the protective system around your knee is starting to fail. Most people respond to knee stiffness by moving less. They sit longer, they avoid stairs, they stop walking as much, and they tell themselves they're being careful. But that's the exact opposite of what the body needs. When you reduce movement to avoid stiffness, you accelerate the muscle loss that's causing the stiffness in the first place. It becomes a cycle. Less movement leads to weaker muscles. Weaker muscles lead to more stiffness. More stiffness leads to even less movement. Within 6 months, that cycle can take you from occasional stiffness to daily pain. Within a year, it can take you from independent movement to needing support just to get up from a chair. The good news is that muscle weakness is reversible, even after 60. The stiffness you feel when you stand is not a permanent condition. It's a signal that your muscles need controlled, consistent strengthening. When you respond to that signal with the right kind of movement, the muscles around your knee start to rebuild. The joint gets the support it needs, and the stiffness begins to fade. You don't need intense exercise or heavy weights. You need movement that's controlled, progressive, and done regularly. That's what this routine is built to do. It strengthens the exact muscles your body is asking you to strengthen, without overloading the joint or triggering more inflammation. And it works because it listens to what your body is already telling you. Why knee pain after 60 is not about your cartilage. It's about what surrounds it. Most people assume knee pain after 60 means their cartilage is wearing out. That's the story they've heard, and it makes sense on the surface. Cartilage cushions the joint. Cartilage wears down with age, and eventually the bones start rubbing together and causing pain. It sounds logical, but it's incomplete. Research shows that plenty of people over 60 have significant cartilage wear visible on imaging, but feel no pain at all. And plenty of others have relatively intact cartilage, but experience chronic, daily knee pain. The cartilage explains part of the story, but it's not the main driver of pain in most cases. The main driver is what surrounds the joint: the muscles, tendons, and connective tissues that control how the knee moves and how much pressure it absorbs. The quadriceps, hamstrings, and calf muscles form a protective system around your knee. When those muscles are strong, they absorb the forces that come from walking, standing, and changing positions. The joint itself only has to handle a fraction of the load. But after 60, if those muscles weaken, they stop absorbing force the way they used to. The knee joint has to take on more of the load directly, and that's when pain starts. The pain isn't necessarily because cartilage is gone. It's because the muscular system that protects the cartilage has stopped doing its job. The joint is being asked to handle stress it was never designed to manage on its own. Here's the part that changes everything. Muscle strength is controllable. Cartilage wear is not easily reversible, but muscle weakness absolutely is. You can rebuild the muscles around your knee at any age, and when you do, those muscles start absorbing force again. The pressure inside the joint decreases, inflammation goes down, pain improves. You don't need new cartilage to feel better. You need the muscles around the joint to start working again. That's why people who strengthen their quadriceps and hamstrings often see dramatic improvements in knee pain, even when imaging shows their cartilage hasn't changed. The cartilage wasn't the problem. The muscles were. This is one of the most misunderstood aspects of knee health after 60. The medical system tends to focus on what's happening inside the joint, because that's what shows up on X-rays and MRIs. But imaging can't measure muscle strength, muscle activation, or how well the muscles are distributing force across the knee. It can only show structure. So when someone comes in with knee pain, they get an image, they see cartilage loss, and the conversation becomes about managing wear and tear. No one talks about the muscles because they're harder to measure and harder to see. But the muscles are often the reason the pain started, and they're almost always the reason the pain persists. When you shift your focus from cartilage to the muscles around the joint, everything changes. You stop thinking of knee pain as an inevitable decline and start thinking of it as a mechanical problem with a mechanical solution. The solution is strengthening. Not aggressive, high-impact strengthening that overloads the joint. Controlled, progressive strengthening that rebuilds the protective system around the knee and takes pressure off the cartilage that's left. That's what the 4 exercises in this routine are designed to do. They don't try to fix the cartilage. They fix the system that protects the cartilage. And in most cases, that's all the body needs to feel better and move better. The real reason your knees hurt more when you do less after 60. It seems like common sense. If your knees hurt, you should rest them. If movement causes pain, then less movement should reduce pain. That logic works for acute injuries, but it doesn't work for chronic knee pain after 60. In fact, the opposite is true. When you reduce movement to avoid knee pain, you usually end up with more pain, not less. The reason is biological. Rest doesn't rebuild the muscles around your knee, it weakens them. And when those muscles weaken, the knee joint has to absorb more force, which increases inflammation, stiffness, and pain. The less you move, the worse the problem gets. Here's what happens when you break the pain inactivity loop. Within 2 weeks of consistent strengthening, the muscles around your knee start to respond. They get stronger. They start absorbing more force. The knee joint experiences less direct pressure. Inflammation begins to decrease. Stiffness improves. Pain starts to fade, not because the cartilage regenerated, but because the muscles are doing their job again. You don't need to do more. You need to do enough, and you need to do it consistently. 3 times a week, 10 to 12 minutes per session. That's the rhythm that rebuilds strength without overwhelming the joint, and that's the rhythm that stops the cycle. The first mistake people make when their knees start hurting after 60. When knee pain starts after 60, most people make one of 2 mistakes. The first mistake is doing too much. They assume the pain means they need to strengthen the knee, so they jump into intense exercise. They do heavy squats, they add weights, they push through discomfort, and they end up making the inflammation worse. The second mistake is doing nothing. They assume the pain means the joint is damaged, so they rest completely. They stop moving, they avoid anything that might hurt, and they end up weakening the muscles that protect the knee. Both approaches make sense emotionally, but both ignore what the body actually needs. The problem with doing too much is that inflamed or unstable knees can't handle high-intensity load. When you add heavy resistance or complex movements to a knee that's already struggling, you increase the stress inside the joint faster than the muscles can adapt. The tissues around the knee become more irritated, not stronger. Inflammation increases. Pain gets worse. People interpret that as proof that exercise doesn't work, so they stop. What actually happened is they chose the wrong type of exercise. The knee didn't need heavy load. It needed controlled, progressive load that rebuilds strength without overwhelming the joint. The problem with doing nothing is that muscles need stimulus to stay strong. When you stop moving, the quadriceps, hamstrings, and calves start to weaken within weeks. The weaker those muscles get, the more force the knee has to absorb on its own. That increases inflammation, stiffness, and pain. Rest feels protective, but it accelerates the underlying problem. The muscles aren't resting, they're atrophying. And every day you wait, the gap between where your muscles are and where they need to be gets wider. What the body needs is the middle path. Controlled movement that strengthens the muscles without overloading the joint. That means exercises that are simple, low impact, and focused on the specific muscles that stabilize the knee. It means starting with body weight or minimal resistance and progressing only when the movement feels stable and pain-free. It means prioritizing consistency over intensity. 3 times a week is more effective than one hard session. 12 minutes of focused strengthening is more effective than an hour of random exercise. The goal isn't to exhaust the muscles, it's to activate them, load them progressively, and let them rebuild. Here's the key insight. Knee pain after 60 is almost never an all-or-nothing situation. It's not a choice between pushing through intense pain or giving up on movement entirely. It's a signal that the muscles around your knee need help, and the right kind of movement is what provides that help. The 4 exercises in this routine are designed to sit in that middle path. They're not too hard, they're not too easy. They're calibrated to rebuild the exact muscles your knee needs to feel stable and move without pain. And they work because they respect what the body is asking for. Not rest, not punishment, but controlled, consistent strengthening that lets the muscles do their job again. The silent muscle loss that happens before your knees give out. Most people don't realize their knee muscles are weakening until the pain starts. But muscle loss doesn't begin with pain. It begins silently, months or even years before the knee becomes a daily problem. After 60, if you're not actively using and strengthening the muscles around your knee, they start to atrophy. The process is gradual, invisible, and easy to miss. You don't feel weaker. You don't notice a specific moment when strength disappears. You just start compensating. You use your hands more when you stand up. You avoid stairs without thinking about it. You sit down more carefully. Those small compensations are your body's way of working around muscles that aren't as strong as they used to be. The quadriceps are usually the first to weaken. This muscle group runs along the front of your thigh and controls the straightening of your knee. It's responsible for absorbing force when you walk, stabilizing your knee when you stand, and controlling your descent when you sit. When the quadriceps lose strength, the knee loses its primary shock absorber. The joint has to handle more direct pressure with every step. The tissues inside the knee experience more friction and stress. Over time, that stress triggers inflammation, and inflammation causes pain. But the pain doesn't show up until the muscle loss has already been happening for months. Here's what makes this muscle loss so dangerous. It doesn't announce itself. You don't wake up one day and realize your quadriceps are 20% weaker than they were 6 months ago. You just notice that standing up feels harder. Walking uphill feels more tiring. Your knees feel stiff after sitting for a while. Those sensations aren't the problem. They're the warning signs that muscle loss is already underway. And if you ignore those signs, the loss accelerates. Weak muscles get weaker faster because you start using them less. The less you use them, the less stimulus they receive. The less stimulus they receive, the faster they atrophy. By the time most people seek help for knee pain, they've already lost a significant amount of muscle strength around the knee. The pain is what finally gets their attention, but the muscle loss started long before the pain did. That's why strengthening is so effective. It's not addressing the pain directly, it's addressing the root cause, the muscle weakness that's been building silently in the background. When you rebuild those muscles, the knee gets the support it's been missing. The joint experiences less stress, inflammation decreases, pain improves. The timeline isn't instant, but it's reliable. Strengthen the muscles, and the knee starts to function better.
The good news is that muscle loss is reversible at any age. Even if you've been sedentary for years, even if your knees have hurt for months, the muscles around your knee can rebuild. They need consistent stimulus, controlled load, and time. That's what the 4 exercises in this routine provide. They target the quadriceps, hamstrings, and calves with movements that are simple, safe, and progressive. They don't require equipment. They don't require a gym. They just require you to show up 3 times a week and give your muscles the stimulus they need to rebuild. And when you do that, the silent muscle loss stops being silent. It reverses. What happens inside your knee? When the muscles around it weaken after 60, your knee joint is designed to move, but it's not designed to carry all the force of movement on its own. It relies on the muscles around it, particularly the quadriceps, hamstrings, and calves, to absorb shock, distribute pressure, and stabilize the joint during motion. When those muscles are strong, they act like a protective cushion. The joint experiences only a fraction of the total force from walking, standing, or climbing stairs. But when those muscles weaken, that protective cushion disappears. The knee has to absorb more force directly, and that changes what happens inside the joint in ways most people never see or feel until the damage is done.
Inside a healthy knee, the bones are separated by cartilage, a smooth tissue that reduces friction and absorbs impact. Surrounding the joint is synovial fluid, which lubricates movement and nourishes the cartilage. When the muscles around the knee are strong, they control how much pressure reaches the cartilage and how evenly that pressure is distributed. Every step, every turn, every shift in weight is managed by the muscles first. The cartilage only has to handle the force the muscles can't absorb. But when the muscles weaken, they stop absorbing as much force. More pressure goes directly into the joint. The cartilage has to handle loads it wasn't designed to manage on its own. Over time, that increased pressure causes irritation. The cartilage starts to break down faster. The synovial fluid becomes less effective at lubricating the joint. Inflammation develops inside the joint capsule, and that inflammation triggers pain. The pain isn't coming from the cartilage itself, because cartilage doesn't have nerve endings. It's coming from the inflamed tissues around the cartilage, the joint lining, the tendons, the ligaments. Those tissues are sending pain signals because they're under stress. And the stress is there because the muscles aren't doing their job anymore. Here's the part most people don't understand. The inflammation inside your knee is a response to mechanical overload, not an inevitable part of aging. If you reduce the mechanical overload by strengthening the muscles around the knee, the inflammation decreases. The tissues calm down. The pain improves. You're not reversing cartilage loss, but you're removing the ongoing irritation that's making the joint hurt. The knee doesn't need to be perfect to feel better. It just needs to be supported. And support comes from the muscles, not from the cartilage.
When you strengthen the quadriceps, hamstrings, and calves, you're directly changing what happens inside your knee every time you move. The muscles start absorbing more force again. The cartilage experiences less direct pressure. The synovial fluid has a chance to do its job without being overwhelmed. Inflammation decreases because the tissues aren't being overloaded anymore. The joint becomes more stable, and stability reduces friction. You're not fixing the structure of the knee, you're fixing the system that protects the structure. And in most cases, that's enough to eliminate or significantly reduce pain. The specific muscle that controls whether your knee pain gets better or worse. If there's one muscle that determines whether your knee pain improves or continues to worsen after 60, it's the quadriceps. This muscle group, located at the front of your thigh, is the primary stabilizer and shock absorber for your knee joint. It controls knee extension, which means it's responsible for straightening your leg when you stand, walk, or climb stairs. It also controls the eccentric motion of sitting down, acting like a brake to lower your body smoothly. When your quadriceps are strong, your knee is protected. When they're weak, your knee is vulnerable. The quadriceps do more than just move your leg. They control how much force reaches the inside of your knee joint with every step. When you walk, your body weight creates impact. That impact has to go somewhere. If your quadriceps are strong, they absorb most of that impact before it reaches the joint. The bones, cartilage, and ligaments inside your knee only experience a small fraction of the total force. But when your quadriceps weaken, they can't absorb as much. More force goes directly into the joint. The cartilage has to handle loads it wasn't designed for. The ligaments experience more strain. The tissues inside the joint become irritated, inflamed, and painful. After 60, the quadriceps weaken faster than most other muscle groups if they're not actively used. This happens for two reasons. First, muscle protein synthesis slows down with age, which means your body doesn't rebuild muscle as quickly as it used to. Second, most people naturally reduce the activities that load the quadriceps heavily, like climbing stairs, getting up from low chairs, or walking uphill. Without regular load, the quadriceps atrophy. And because they're such large muscles, even a small percentage of strength loss has a big impact on how the knee functions. Here's the critical insight. Quadriceps strength is one of the most reliable predictors of knee pain and function in people over 60. Studies show that people with stronger quadriceps report less knee pain, better mobility, and greater independence than people with weaker quadriceps, even when both groups have similar amounts of cartilage wear on imaging. The strength of the muscle matters more than the condition of the cartilage. That's why targeting the quadriceps specifically is so effective. You're not trying to strengthen the whole body. You're strengthening the one muscle that has the biggest impact on whether your knee hurts or not. The first exercise in this routine, knee extension, is designed specifically to rebuild quadriceps strength. It's a simple movement. You sit in a chair, straighten one leg, hold it for a moment, and lower it back down. But that simple movement loads the quadriceps in exactly the way they need to be loaded to get stronger. It's controlled, it's low impact, and it isolates the muscle so you're not compensating with other parts of your body. Done consistently, 3 times a week, that one exercise can rebuild enough quadriceps strength to significantly reduce knee pain and improve stability. It's not flashy, it's not complicated, but it works because it targets the muscle that matters most. Why doctors don't always explain the muscle pain connection in knee problems.
After 60, when you go to a doctor with knee pain, the conversation usually focuses on what's happening inside the joint. You might get an X-ray or an MRI. The doctor looks at the images, sees cartilage thinning or bone changes, and explains that you have osteoarthritis or degenerative joint disease. The conversation centers on managing symptoms, pain medication, anti-inflammatory drugs, maybe a cortisone injection. Surgery gets mentioned if the damage looks severe. What often doesn't get mentioned is the role of muscle weakness. Even though muscle weakness is one of the most common contributors to knee pain after 60. This isn't because doctors don't know about the muscle pain connection. Most do. The research is clear. Quadriceps strength is strongly associated with knee pain and function, especially in osteoarthritis. But the medical system is structured around diagnosing and treating structural problems, not functional ones. Imaging shows structure. It shows bones, cartilage, ligaments, and fluid. It doesn't show how strong your muscles are or how well they're activating. So the conversation stays focused on what the images reveal. Muscle weakness is harder to measure in a 10-minute appointment, and it's not something that shows up on a scan. There's also a time constraint. Most doctors have limited time with each patient, and that time is spent addressing the primary complaint, ordering tests, and discussing treatment options. Explaining the biomechanics of muscle weakness and how to strengthen the muscles around the knee takes time. It requires patient education, follow-up, and often a referral to physical therapy. It's easier and faster to prescribe medication or recommend rest. That doesn't mean the advice is wrong. It just means it's incomplete. The medication might reduce inflammation, but it doesn't address the muscle weakness that's causing the joint to be overloaded in the first place. Another factor is that strengthening muscles requires the patient to do the work. It's not a passive treatment. You can't take a pill or get an injection and have stronger quadriceps 2 weeks later. You have to do the exercises. You have to do them consistently. And you have to be patient while the muscles rebuild. That's a harder message to deliver than a prescription, and not every patient is ready to hear it. But the patients who do hear it and act on it often see results that medication alone can't provide. They experience less pain, better mobility, and greater confidence in their knees. Not because the cartilage healed, but because the muscles started doing their job again. The gap in typical medical explanations is why education like this matters. You need to understand that knee pain after 60 is not just about what's inside the joint. It's about the system that surrounds the joint. The muscles control how much pressure the joint experiences. When the muscles are weak, the joint is overloaded. When the muscles are strong, the joint is protected. That's the connection that doesn't always get explained in a medical appointment. But it's the connection that makes the biggest difference in how your knees feel and function over time. The daily movement pattern that quietly weakens your knees. After 60. The movement pattern that weakens your knees the most after 60 isn't dramatic. It's not a fall or an injury. It's the slow, steady reduction in how much you use your legs throughout the day. You start sitting more and standing less. You take the elevator instead of the stairs. You drive instead of walk. You avoid getting up and down from the floor. Each individual choice feels minor, but the cumulative effect is significant. You're removing the daily stimulus that keeps the muscles around your knee strong, and when those muscles stop being challenged, they weaken. The quadriceps, hamstrings, and calves need regular load to maintain strength. Load means resistance. Every time you stand up from a chair, climb stairs, or walk uphill, you're loading those muscles. They contract, they work, and they adapt by staying strong. But if you reduce those activities, the muscles lose the stimulus they need. Within weeks, they start to atrophy. The process is invisible at first. You don't feel weaker. You just notice that certain movements feel harder. Standing up takes more effort. Walking feels more tiring. Your knees feel stiff after sitting. Those sensations are early signs that the muscles are losing strength. Here's what makes this pattern so insidious. It's driven by avoidance, and avoidance feels protective. When your knees start to hurt or feel unstable, your natural response is to avoid the movements that trigger discomfort. You sit instead of stand. You rest instead of walk. You take the path that requires the least effort. In the short term, that reduces pain. But in the long term, it accelerates the muscle loss that's causing the instability in the first place. The less you move, the weaker the muscles get. The weaker the muscles get, the more unstable the knee feels. The more unstable it feels, the less you want to move. It's a cycle, and it can take you from independent mobility to needing assistance in less than a year.
Breaking this cycle doesn't require you to go back to the activity level you had at 40. It just requires you to keep the muscles around your knee active and strong enough to support basic function. That means standing up from chairs without using your hands when possible. That means walking regularly, even if it's just around your house or yard. That means doing controlled strengthening exercises 3 times a week that load the quadriceps, hamstrings, and calves in a safe, progressive way. You're not trying to become an athlete. You're trying to maintain the muscular foundation that keeps your knees stable and pain-free. The 4 exercises in this routine are designed to replace the movement stimulus that daily life used to provide. They load the muscles in the same way that standing, walking, and climbing stairs do, but in a controlled, low-impact format that doesn't overwhelm the joint. They give your body the signal it needs to keep those muscles strong, even if your daily activity level has decreased. And they work because they address the root problem. Not the joint, not the cartilage, but the muscles that protect the joint and absorb the forces that would otherwise cause pain.
What your body loses when you stop using your knees. Normally, after 60. When you stop using your knees normally after 60, the first thing your body loses is muscular control. This isn't the same as losing strength, though strength is part of it. Muscular control means your ability to activate the right muscles at the right time to stabilize a joint during movement. It's what allows you to stand up smoothly, walk without wobbling, and catch yourself if you start to lose balance. When you reduce activity, the nervous system stops reinforcing those movement patterns. The brain-muscle connection weakens. Your quadriceps stop firing as quickly or as strongly when you need them. Your hamstrings and calves stop coordinating as well. The result is that movements feel less stable, less controlled, and more effortful. The second thing you lose is joint stability. Stability comes from the muscles, tendons, and ligaments working together to keep the knee aligned during movement. When the muscles weaken, the knee becomes less stable. It might shift slightly inward or outward when you walk. It might buckle when you go downstairs. It might feel like it's going to give out when you stand up. Those sensations aren't always signs of structural damage. They're signs that the muscles aren't strong enough to stabilize the joint properly. And when the joint isn't stable, you compensate. You walk more carefully. You avoid certain movements. You use your hands to help you stand. Each compensation reduces how much you use the muscles, which makes them weaker, which makes the knee less stable. The third thing you lose is confidence. When your knees feel unstable or painful, you start to doubt your body's ability to support you. You become more cautious. You avoid activities you used to enjoy. You stop going places that require walking or stairs. You start planning your day around where you can sit and rest. That loss of confidence accelerates physical decline because it reinforces the avoidance behavior that weakens the muscles in the first place. Fear of falling or re-injury keeps you from moving, and the less you move, the more you have to fear.
The fourth thing you lose, and this is the one that matters most, is independence. Independence after 60 is largely determined by your ability to move without assistance. Can you get up from a chair on your own? Can you walk to the bathroom, the kitchen, the mailbox? Can you go up and down stairs safely?
Those basic functions all depend on the strength and stability of your knees. When your knees weaken to the point where those movements become difficult or painful, you start needing help. You need someone to assist you. You need equipment. You need modifications to your living space. The loss isn't sudden, but it's profound. And it usually starts with the decision to rest instead of move. Here's the key insight. Everything your body loses when you stop using your knees normally can be rebuilt with the right kind of movement. Muscular control can be retrained. Stability can be restored. Confidence can be regained. Independence can be protected. It doesn't happen overnight, and it doesn't happen without effort. But it does happen. And it happens because the muscles around your knee respond to consistent, controlled strengthening. That's what the exercises in this routine are designed to do. They rebuild the muscular foundation that supports every movement your knees make. And when that foundation is strong, your body stops losing what it needs to stay independent.
The 10-minute routine that rebuilds knee strength without overloading the joint. The routine that rebuilds knee strength after 60 doesn't need to be complicated, and it doesn't need to be long. It needs to be targeted, controlled, and consistent. The 4 exercises in this routine take 10 to 12 minutes total, and they're designed to strengthen the exact muscles that protect your knee: the quadriceps, the hamstrings, and the calves. Each exercise loads those muscles in a way that's safe for the joint, even if you're already experiencing pain or stiffness. There's no jumping, no twisting, no heavy weights. Just controlled movement that gives your muscles the stimulus they need to rebuild. The first exercise is knee extension. You sit in a chair with your feet flat on the floor. You slowly straighten one leg, lifting your foot off the ground until your knee is fully extended. You flex your toes toward your shin. Hold the position for 2 seconds and feel your quadriceps contract. Then you lower your leg back down slowly and with control. You do 3 sets of 8 to 12 repetitions per leg. This exercise isolates the quadriceps, which is the muscle that has the biggest impact on knee stability and pain. It's simple, but it's incredibly effective because it loads the muscle in exactly the way it needs to be loaded to get stronger without putting stress on the joint. The second exercise is the hamstring bridge. You lie on your back with your feet elevated on a low step or sturdy box. Your knees are bent at about 90 degrees. You press your heels down into the surface, engage your hamstrings and glutes, and lift your hips off the ground until your body forms a straight line from your shoulders to your knees. You hold for 2 seconds, then lower back down with control. You do 3 sets of 8 to 12 repetitions. This exercise strengthens the hamstrings, which control the back of your knee and work with the quadriceps to stabilize the joint during movement. It also engages the glutes, which help control hip alignment and reduce stress on the knee. The third exercise is calf raises. You stand facing a wall, with your hands lightly resting on the wall for balance. You slowly rise up onto your toes, lifting your heels as high as you can. You hold for 1 second at the top, then lower back down with control. You do 3 sets of 8 to 12 repetitions. This exercise strengthens the calves, which control movement up the leg and play a key role in how the knee absorbs force when you walk. Weak calves contribute to knee instability, and strengthening them improves overall leg function and reduces the risk of compensatory movement patterns that can make knee pain worse. The fourth exercise is the sit-to-stand progression. You start by standing up and sitting down from a chair 10 times in a row, using normal form. Once that feels manageable, you progress to a staggered stance version. One foot stays flat on the floor, and the other foot moves slightly back so only the toes are touching the ground. You stand up, using mostly the front leg to drive the movement. You sit back down with control. You do 10 repetitions on one side, then switch legs. This exercise builds functional strength in the quadriceps, hamstrings, and glutes in a movement pattern that directly translates to daily life. It's the movement you use to get out of a chair, and strengthening it makes that movement easier, safer, and less painful. You do this routine 3 times a week, with at least 1 day of rest between sessions. The rest days are just as important as the exercise days, because that's when the muscles rebuild and adapt. You don't need to do more than 3 sessions a week. More isn't better. Consistency is better. 10 to 12 minutes, 3 times a week, is enough to rebuild the strength your knees need to feel stable and move without pain. It's not about intensity. It's about showing up, doing the work, and letting the muscles respond. How your knees respond when you strengthen the muscles around them. After 60.
When you start strengthening the muscles around your knee, the first change happens inside the muscle tissue itself. Within the first 2 weeks of consistent exercise, the muscles begin to adapt. Muscle fibers start to recruit more efficiently, which means the muscle can generate more force even before it gets visibly bigger or stronger. This is called neuromuscular adaptation, and it's one of the earliest benefits of strengthening exercises. Your quadriceps, hamstrings, and calves start activating more quickly and more completely when you move. That improved activation translates to better stability and control in the knee joint, even if you don't feel dramatically stronger yet. By the 3rd and 4th week, the muscles start to rebuild structurally. Muscle protein synthesis increases, and the muscle fibers begin to grow and repair. You might notice that standing up from a chair feels easier. Walking feels smoother. Your knees feel more stable when you move. The stiffness that used to show up after sitting for a while starts to fade. These improvements aren't because the cartilage inside your knee has healed. They're because the muscles are doing their job again. They're absorbing force, stabilizing the joint, and reducing the amount of direct pressure that reaches the cartilage and other tissues inside the knee.
Around the 6-week mark, inflammation inside the joint starts to decrease. This happens because the muscles are now strong enough to reduce the mechanical overload that was triggering the inflammation in the first place. When the quadriceps and hamstrings absorb more force, the tissues inside the knee experience less stress. The synovial fluid has a chance to lubricate the joint properly. The joint lining calms down. Pain decreases, not because you've taken medication, but because the root cause of the pain, the muscular weakness and joint overload, has been addressed. You're changing the mechanics of how your knee moves, and that change directly reduces inflammation. Between 2 and 3 months of consistent strengthening, most people experience noticeable improvements in pain, stability, and function. They can walk longer distances without discomfort. They can go up and down stairs with more confidence. They can stand up from a chair without using their hands. Those functional improvements are the real measure of success. You're not strengthening your knees so they look better on an MRI. You're strengthening them so you can move through your day without pain, without fear, and without needing assistance. And that's exactly what happens when the muscles around the knee are strong enough to do the job they were designed to do. The response timeline varies from person to person. Some people feel better within 2 weeks. Others take 2 months. But the pattern is consistent. When you strengthen the muscles around your knee, the knee responds. Stability improves. Pain decreases. Function increases. And those improvements last as long as you continue to maintain the muscle strength. You don't need to do the routine forever at the same intensity, but you do need to keep the muscles active. 3 times a week is the rhythm that rebuilds strength. Twice a week is often enough to maintain it once you've reached a baseline level of function. The key is not stopping. The key is treating muscle strength as something you maintain, not something you achieve once and then forget about. What happens to your mobility when you ignore early knee weakness after 60? When you ignore early knee weakness after 60, the progression is slow at first, then accelerates. In the first 3 to 6 months, you might notice occasional stiffness, minor discomfort, or moments where your knee feels unstable. Those sensations are easy to dismiss. You shake them off, you adjust how you move, and you keep going. But during that time, the muscles around your knee are continuing to weaken. The quadriceps lose strength, the hamstrings lose coordination, the calves stop activating as efficiently. You're not aware of the loss because it's gradual, but your body is compensating.
You start using your hands to push yourself up from chairs. You avoid stairs. You walk more slowly. Each compensation reduces how much you use the muscles, which accelerates the weakening. Between 6 months and a year, the stiffness and discomfort become more consistent. Your knees hurt after sitting for a while. They ache at the end of the day. You feel them when you stand, when you walk, when you go up or down stairs. The pain is no longer occasional. It's part of your daily experience. At this stage, many people start to restrict their activity significantly. They stop walking for exercise.
If this video helped you, the next one might reveal something important about your body. Take a moment to watch it now. You may notice something you've been ignoring.